slightly over half of the kids referred to us are regularly attending school at time of referral. And once they've successfully completed our program, that number goes up to about 83%.
Wow.
And that's just huge jump in terms of academic achievement. And we know what a high school degree can get you in terms of future earning potential and economic independence and reduce risk for re-victimization.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content.
Hi, everyone. Welcome to the Public Health Insight Podcast. Today, I am joined by Erin Williamson, who spent the last 2 decades working to keep kids safe from exploitation. Currently, she's the Chief Programs and Strategy Officer at LUF 146, where she leads national prevention efforts and survivor support programs. Welcome to Public Health Insight, Erin.
Thank you so much for having me.
It's so great to have you here today. We're going to be chatting about your general trajectory, your career, all your work at LUF 146, and then beyond as well. So for many people, of course, the transition from high school to university is when they start thinking seriously about their future, about their career. When you were making that leap, what career possibilities were on your mind? And how'd you get into all of this?
Yeah, that's a great question. It was kind of a journey, right? In undergrad, I studied social work. And for my study abroad, I went to Kenya. And that was kind of where I first became aware of street children and children who were living on the street, many of them by themselves. Some of the younger ones were with their parents, but many of the older ones were just by themselves, and really became aware of kind of child sex trafficking while I was over there. And like many people, thought it happened over there and really was focused. And so then when I graduated, I decided that I wanted to see what did this look like in other countries? And I wanted to learn Spanish. I had studied French in high school and college. And so I went and lived in Oaxaca, Mexico, also working with street children there. So when I came back stateside, I really thought I was going to do international development. And I went and got master's in public administration with a focus on international development. And, there's this weird thing about social work where if you have your bachelor's, you can get a master's in 1 year. And so while I was in kind of the school mode, I tacked on that year and also got a master's in social work. And those 2 masters have really helped, I think, shape my career and how I've thought about things. I was focused internationally at first, and then, like many people, became aware that this was also happening in the United States and started working for Polaris, which runs our national human trafficking hotline here in the United States. Then I kind of became a little thoughtful in how do we know that what we're doing is having efficacy, right? It was a very, very new field, kind of officially, the anti-trafficking field. I think there were a lot of people with really wonderful intention, really good work, but we did see the cycle of individuals coming in and out of our shelters, and really what we were seeing was the cycle of trafficking. And so I went and started working for an organization called ICF, where I was able to learn how to do research and evaluation on federally funded victim services programs. And then when my husband got a job in Connecticut and we moved our family here, I was fortunate enough to land for an organization called LUF 146, and I was hired to build their survivor care program. And one of the really wonderful things that I was able to do was build it with an eye towards evaluation. And so since the beginning, we've been collecting data. We've been having a focus on how do we partner with external evaluators, and we're currently being evaluated by the University of New Hampshire's Crimes Against Children Research Center, both for our survivor care program as well as our prevention education program, which I now also oversee.
Wow. That's an incredible, incredible journey. I've seen a lot of public health or social workers who go from working globally to coming back to home and really seeing that these issues exist here too. I think a lot of times even in global health and international development, we tend to be so outwardly focused, and coming back and seeing and making a difference at home is a really great trajectory I've been seeing more and more of, actually, which is good to see. To kind of go back to your education, you got your BSW and then your MSW, and then you followed up with your MPA, which is quite a progression. You said that those two masters have really shaped your understanding and the work that you do. What keeps you driving to add things to your toolkit? And really, what were you thinking when you kind of did both those masters? Is there a certain idea that you had in the skill sets that you were gaining, and how have they shaped the work that you've done?
Yeah. I think, initially I was young and I was just trying to figure out how to set myself up for as many possibilities as possible. Ironically, going into a field where a lot of what I heard initially was, this is new, this is a fad, this isn't going to last, why are you dedicating yourself to this? But really trusting my gut that this was something that I cared deeply about and I wanted to invest in. And even if that investment was a short period of time, I felt confident that I could take that knowledge and pivot if I needed to. One of the reasons I really love these two masters together is because my social work degree was really focused on individual intervention, really focused on children. How do you do therapeutic intervention with children? What does that look like? How do you make sure it's evidence-based? And then my MPA was really focused on systems and how do you change systems and how do you look at either working within or partnering with government systems as well as private systems to kind of leverage change at a larger macro level. And I have found that understanding of both the micro individual level and that macro level, and even the kind of the in-between level, which is oftentimes called the meso level, has really helped me because we've been able to take our on-the-ground knowledge of working with individual children at Love 146 and really advocate for change. And sometimes that's legislative change, sometimes that's internal policies and practices within government agencies. I've always said I'm an advocate at heart, right? I am somebody that likes to push forward. I'm somebody that likes to be challenging of the systems. But I think it really does help to have an understanding and appreciation for the systems, because I do think that a lot of the people who work within those systems also want to do really good work and also came to their work with the best of intent. And sometimes they also are frustrated with the same things that those of us on the outside are frustrated with. And so I think that having that balanced understanding and then also being able to translate the language, right? Being able to explain to people who work at a systems level how things play out, though, at an individual level. Like, I get that this is what you intended when you structured things this way, but what we're seeing on the ground is actually this. And vice versa, explaining to our individual social workers that we now oversee, yes, I understand that you really want to advocate for this child, but when they create policies and procedures within systems, they can't just think of every single individual child. They have to think on a more macro level because they just have so many kids that they're responsible for, and they need to provide guidance across different offices and different individuals. And so that's been really, really helpful, being able to kind of straddle that fence.
Yeah, absolutely. And I believe that's a general barrier for a lot of work that happens on the ground through prevention programs versus building that bridge with the policymakers. And to be able to work on both sides and understand each party really helps in your position, of course, but also with the teams that you manage to understand how to get the work done at a faster pace. You mentioned ICF International as well, and you spent about 5 years there, if I'm not wrong, before moving to Love 146. What were you working on there, and what was that experience like for someone with your background in social work?
Yeah, I loved that experience, and it was really wonderful, and I think really set me up and Love 146 up well as we established these programs. I went there because I really wanted to understand, how do we evaluate victim services, right? What is considered quote unquote success? How do you do this ethically? Because of my background, a lot of my work was in the qualitative evaluation, was in talking with victims who had gone through different programs, talking with law enforcement, with service providers, getting their perspective. And then I worked alongside people who did the quantitative work and really analyzed kind of the data. And it was really wonderful to see how our work came together to build the story, right? they could share the understanding of kind of what the impact was, and I could share more of the why that was, or if we didn't find efficacy, explain a little bit about why that was happening. I think I also learned really what evaluators need to do an evaluation, and this is where I actually feel quite strongly we do not do enough as we're teaching people to go into fields for them to understand kind of, if you're going to develop a program, here is how you need to set it up to prep it for evaluation, right? I remember when I was in my master's in social work degree, I got to the evaluation course, and all of the teachers and administrators in our center kind of said, oh, everybody hates this course. You just got to get through it. It's mandated for you. And I loved it because I had loved math in school, and I just loved I wanted to know that I was having impact. But I think we set people up by saying, everybody hates courses like this. You just have to go through it, as opposed to saying, it's really important that we know that what we're doing is having impact, right? We are working with individuals. We are impacting their lives. We want to know that what we're doing is helpful, is effective. We want to know how to improve it, right? There's always areas for improvement, and we really can only know that if we're collecting data. And I'll give you just a really quick example of how we used the data early on. I remember setting up the systems to collect data, and I had a bunch of social workers come to me and they said, we really think that this program is more effective with older adolescents. We really think that we have more impact when the kids come to us and they're 16 and 17-year-old, and we're less impactful when they're 13, 14, and 15. And we think that should be a criteria for how we prioritize children coming into our program. And I said, okay, well, that's interesting. And I knew that they kind of enjoyed the older adolescents a little bit more as well. So I thought, okay, let me run the data. And I ran the data by age at time of entry, by race at time of entry, by, a number of different qualifiers, both identifiable, like things that have to do with identity, but also like, are they a confirmed victim or a suspected victim? Are they, things like that. And I was able to go back to them and say, look, we actually have slightly better outcomes with our 14-year-olds and our younger kids than we are with our older kids. Not saying that we're not impactful with our older kids, but actually, if you're going to compare ages, we actually are better with the younger kids. And why could that be? And it really just shifted both how our social workers were thinking about our population and how we move forward with kind of the structure of the program, and really encouraging early referrals to the program so that kids didn't have to wait until maybe they had experienced, one or two victimizations, 2 or 3, before getting a referral to us.
That's actually an amazing story. I think numbers are such an essential part of any storytelling and impactful storytelling. How did you take what you learned from like that evaluation work, I guess we could talk about? How did you take that and draw it into your work at Love 146? And how did that bridge happen between the two experiences for you?
Yeah, so, in social work, you're taught the importance of case notes, right? And case notes are really important, and they really drive your work, and you have to have a care plan and then follow. And case notes are really narrative. It's a written kind of summary of what you talked about and kind of what you did in that session is supporting your long-term plan with that individual. And one of the things that I realized through ICF was that, qualitative narrative format is really important. But if you also want the quantitative data, you have to have check boxes. You have to have drop-down menus. You have to be able to select things that then you can compare. And so we set up data collection in a way where we track, for example, how long did we spend with a youth by 15-minute intervals. Wow. And so it's just a drop-down box that our staff can fill in. We have about 20 things that people can check off in terms of what services did you provide. Did you provide crisis intervention? Did you provide information on health and wellness? Did you provide housing information? So that we can track what type of services are we providing most, so we could see what's impactful. Even in our care plan, we say, okay, has there been slight progress, significant progress? Has this care plan goal been completed? And we track that every 30 days. So we're able to see the progress. And, we actually, with our evaluators at University of New Hampshire, we gave them, about from 2016 to 2000, I believe, in 21. So we gave them 5 years worth of de-identified data that they were then able to comb through and analyze. And they actually published a paper fairly recently showing that we were having such significant impact re-engaging kids in education. Slightly over half of the kids referred to us are regularly attending school at time of referral. And once they've successfully completed our program, that number goes up to about 83%.
Wow.
And that's just huge jump in terms of academic achievement. And we know what a high school degree can get you in terms of future earning potential and economic independence and reduce risk for re-victimization. While that was one of the things that we were focusing on, we were actually more thoughtfully focusing on the impact of the trauma, right? How do we make sure these youth understand the trauma they've experienced, their parents or caregivers understand it, that they're getting that appropriate? We, of course, know that education is important, but I don't think we even realized the impact that we were having on education and that it was so significant until we ran those numbers and were really able to see, almost a 30% jump in educational attainment. And many of those kids we were actually then seeing go on to post-secondary education, whether that be a college or an associate degree or some sort of vocational training or certificate, which again just sets them up for such a more independent, economically independent future and significantly reduces their risk for future victimization.
Wow, that's fantastic. That's a big jump.
Sure.
The joy, I'm sure you must have felt like, oh, wow, we're really making a difference. That's amazing. So from there, how did you find out about the work that Love 146 does? And what drew you to it? Was it something about their mission, their approach? What made you think this is where I need to be next?
Yeah, so full disclosure, I followed my husband to Connecticut from Washington, D.C., from a really wonderful career in Washington, D.C. for 10 years, and came to one of our smallest states with not really a clear understanding of what I was going to do. My husband is very specialized in his field, and there were only about 5 jobs in the entire United States.
Wow.
So the options were somewhat limited, and we just we stayed on the East Coast because that was closer to family. And I had been here for a couple of months, and I saw this job posted, and it was for, child trafficking. And again, being Connecticut in a small state, I knew about Love 146. I had done my research, and I had reached out to various individuals trying to meet and connect with them. But the job description was just crazy. It was serve kids while building a statewide program while impacting policy.
Wow.
I mean, the job description was just completely unrealistic. And I thought, this is going to completely burn me out. I have a little young kid at home and I can't do this. And I ended up going to a wedding with some friends in the movement and asking other people's opinions. I said, there's just not a lot in Connecticut. This might be my only chance. And they're the ones that suggested that I apply. So here's a great lesson. I applied, and I got an email back saying that I was not qualified for the position because they wanted a clinically licensed social worker. But they were willing to meet me for coffee. And partly why they were willing to meet me for coffee was because when they went to respond to me and email me, my email popped up automatically in their kind of to field within their, so they knew that they had somehow seen my email before, and they did a search and they realized that another person that I had met with in the state, just kind of doing those meet and greets, had emailed them and told them about me and said that I was really wonderful and they should connect with me. So they kind of did a courtesy coffee with me as a result because of that email. And during that coffee, I just said, I would love to help out in any way possible, even if that's volunteer. Here are some thoughts and ideas that I have, and here's why, and this is what I've been thinking about. And at the end of that coffee, the individual I was meeting said, I think we might be able to change the requirements for the job, and went back and spoke with the executive director at the time, and they brought me in for an interview, and I got the job. So.
Wow.
Even if you don't have all the qualifications, right? Sometimes you just throw your hat in the ring and it can work out.
That is a great story. That's amazing. Well done. when you did start, was it obviously, I think when they changed the description stuff for you, was the work still really big and like overwhelming as you were expecting, or were they able to kind of adjust to your experiences and such?
So another fun story. So
I'm buckled in.
Right. I started, and I think I started on maybe January 4th, and we saw our first youth on January 18th.
Yeah.
So we were really building the plane as we were flying it in terms of the program. And in some ways we needed to do that, right? We needed to be able to establish ourselves as having clout within the sector. And there were kids that really needed services, and there were very few people at that time in our state who are comfortable having conversations about trafficking with children. And so we were kind of starting to get referrals. And then about, I don't know, maybe 6 months into my job, our executive director took me out for coffee, and he said, so where are we with kind of like the home? And I said, what are you talking about? And he goes, well, like the round home that we have in the Philippines, we're going to replicate it here in Connecticut and do residential. And I said, no one said anything about residential. And he goes, well, what do you mean? I said, you guys never said anything about residential when you hired me. And I said, in fact, I don't think residential is a good idea. I think that, first of all, it's extremely expensive. You can only serve about 5 or 6 kids at a time. And housing is not the issue that we have in the United States, at least at that time in Connecticut. The issue we have is service provision. There are group homes that exist. There are foster care placements. And most of these kids are living with their biological families and kinship programs. We can serve so many more kids and keep them stabilized in the housing that they're in, and be so much more impactful than pulling kids out of their homes in order for them to get treatment. So I don't think that residential is right. And he said, well, that's not what we told our funder. And I said, okay. And I will say I was in a very, very privileged position at that time, because I was able to say to him, I don't believe in residential services. And if that's what you're looking for, I'm not sure that I'm the person that you want. And I had to call my direct supervisor after that call, and I said, I just want you to know you might be asked to fire me. And I want you to know that that's okay. I understand that that might happen. And to their credit, they didn't fire me. They kind of allowed me to build the program as I saw fit. And to our initial funder's credit, they went back to him and they explained to him why we were pivoting away. And he was so gracious and so understanding and said, honestly, my goal is to help as many kids as possible. And so if this is the way to do it, I fully trust you. Mm-hmm. And we were able to then build that program, and it now serves, between 125 and 150 youth a year. We have over 20 staff, and it really was because we were given the freedom to try something different, right? Mm-hmm. Residential was the go-to that they were doing at that time. And we were able to instead of saying you have to leave your homes or you have to come to us mm-hmm. in a drop-in center, we actually now have cars for all of our social workers, and they go out into the field. They meet with kids in their home communities, and we have a motto, we go where you go. So even when kids change their placements or their family moves within the state, or maybe they go inpatient hospital because they're experiencing suicidal ideation, that same social worker goes and works with them and visits them no matter where they are in the state, mm-hmm. which is just flipping the model kind of on its head, but has such a difference in terms of impact and in terms of our ability to support kids in building a sense of coping skills and community and trust within their own communities, mm-hmm. as opposed to removing them and then placing them back in the communities without helping them to learn how do you cope within sometimes very complex community and family structures.
Mm-hmm. Good call on that, I'd say. And I think there's a lesson for sure to be learned by sticking to what your experiences have taught you, to say like, no, residential is not a good idea. We need to meet them where they're at and actually carry out service provision in that way. Were there specific examples or stories from your time as a social worker that you reflected on in that time to inform that decision, or was it just generally your experience at large up until then?
I had worked in residential prior to coming to Love 146. I had worked in both a boys group home and a girls group home. And so I was very familiar with the residential model and with the pros and the cons of that model, right? I'm not knocking full on residential. There are times where that unfortunately is the option that we have to offer a child for a wide variety of reasons. But it's kind of like the option of last resort, right? That's not an option that we want to be a primary option that we offer to kids and their families. I never want a family to feel like in order for my child to get services, I have to put them somewhere, right? Or I have to sign away rights or sign away care. I that's not the goal, right? I really do believe that, and the research really does show that children do best when they are maintained in their family, right? We know that foster care causes its own trauma. Being removed from your nuclear family causes its own trauma in your nuclear communities. And so it really should only be done in the most egregious cases where safety just is not possible, and even after significant intervention, it's just not possible. And so that is the model that I think we were moving towards. That when we started the program as a field, I think we've moved even farther towards that understanding over the last decade. But really, it was a desire to support kids in the communities and in a manner that really centered them and didn't center our workers, right? I think that a lot of times we have people come to us, and I'm not talking about urban areas where transportation is easy, but when we think of barriers and access of care, transportation is huge. It's a huge barrier for so many people, both because they lack transportation, they lack public transportation, and just the cost, right? Gas is expensive, and usually families have multiple children that they're caring for, and so it can be really hard when transportation is a barrier. And so it really felt like if we know that that's such a barrier for so many kids and families, let's just cut that out. And we're going to provide the transportation by going to those children. And if we need to take that kid to an appointment, or if we need to take that kid to an outing, we have the car then, and we can do it. And that, I think, has really been a huge game changer for us. Now, our staff do a lot of driving, and it's a really, we do consider that when we think about how many cases we assign to each staff, because that is an element of burnout, is just the driving that can happen if a kid is moved to an area of the state that's much farther away.
Absolutely. I think it was in a video that you had shared, or somewhere you say that healing is relational, not transactional. Is there specific examples from your direct service days, or even now at Love 146, where you see that principle in action?
Absolutely. So, first of all, trafficking happens within relationship. If we really are going to be honest, traffickers, it's not kidnapping. It's not like that has rarely happened amongst the youth that we have served, that they're just kidnapped and forced to do this. So often, traffickers either leverage relationships that already have with the kids, or they create relationships with the kids so that by the time they're being exploited, they are no longer kind of a stranger, someone that child doesn't know. They're their boyfriend, their best friend, the father figure they never had, the mother figure they never had. And so, this form of exploitation happens in relationships, right? And really, one of the things that makes these kids oftentimes vulnerable is they are seeking relationship, right? They're seeking love. They're seeking parental figures. They're seeking that. That's not always the case. Sometimes they're seeking basic needs. Sometimes there's other reasons, but it is a need for many of our children. And so what we want to do is we want to really mirror, okay, what does a healthy relationship look like for you, right? And a healthy relationship doesn't mean it's perfect. It doesn't mean that we don't ever disappoint you, or we don't ever disagree with you or make you upset. It means that when we have those moments that you might be mad at me because, unfortunately, I popped a tire on my way to coming to you. And this is a true story, right? I popped a tire on the way to going to see a youth, and I had to call them up, and I had to say, the tow truck's saying 45 minutes. I'm another half an hour away. I really don't think I'm going to get there today. Let's reschedule. And when I came a couple of days later, that youth was pissed, right? Like, they were mad. Understandably, they had really looked forward to our visit, and I kind of failed them in their eyes. And we had to work through that, right? We had to talk about that, and we had to talk about, like, I get that were disappointed. I get that you didn't like what I did or the choice. That's okay. How do we move on, right? And so teaching them within that relationship, how do you work together to move on from things? How do you repair broken relationships with people who have your best interest, right? Because again, a lot of our kids are used to, if they get in a fight with someone or if a friend bothers them or does something, they just sever the relationship and they try to start over with someone else. And that's not going to be sustainable, right? And exploiters are going to utilize that to pull them away from people who really do have their best interests. A lot of them also have challenging relationships with their siblings, parents, caregivers. I was a horrible teenager. I went through issues with my mom for sure. And adolescence is a hard time where you're trying to exert your independence from your family, and you also really, really need them for both physical and emotional reasons. And so helping them to understand how do you navigate this time, and also helping parents to understand, look, your child is sometimes just behaving like a normal adolescence, and sometimes they're having a trauma response. And those are both real for you, given what your child has been through. And how do kind of we give you the information, the skill sets, and the support so that you're able to differentiate those two things. And you're also able to care for yourself, because caring for a child who's experienced significant trauma, when many of our parents have also experienced their own trauma histories, is challenging, right? That's a real challenge.
Before we end off this episode, though, we're going to do a quick little rapid fire section. So switching gears a little bit. So our rapid fire segment here at PHI is called the Insight Blitz. So I'm going to throw some quick questions at you. Just no overthinking, whatever your first instincts are.
Perfect.
Ready?
Yep.
Okay, so number 1. Was there a moment in your career where you realized the person in front of you had been failed by every system that was meant to protect them?
There's been multiple moments in my career where I have just looked at that youth and said, every system has failed you. And usually it's validation, right? Yeah. It's validating for them. Like, you're right. This is unfair. This is what happened to you is unfair. And there's we have to move on from here, right? We can't get stuck. You are still at such a young point in your life, and you have so many years ahead of you that it's true. It's been unfair, and let's create a plan to move forward.
What is the most dangerous myth about trafficking that even well-meaning people believe?
There's a lot of myths out there. There's a myth about Wayfair being involved. There's myths about trafficking happening under the state capitol. I think one of the most dangerous myths, though, is still the idea of stranger danger. Because then when we are talking with our kids about how to protect themselves and what they need to look out for, we're reinforcing the idea that traffickers can never be somebody that they know or somebody that forms a relationship with them. And so I still do think, even with all the conspiracy theories that are out there with trafficking, the biggest myth, and this is not just trafficking, this is all forms of sexual violence for children, the biggest myth is stranger danger.
If you could have dinner with anyone, living or dead, who would you bring to the table?
I would definitely love to sit down with Warren Buffett. I just find his ethos around both living in a capitalistic society, but also his generosity and what money should and should not mean within a lifespan is just really fascinating. And I would love to talk with him about it. Michelle Obama, I think she is such a strong and fiercely independent woman who has also, and I'm going to use this term even though it a little different, but has like survived so much, right? Like there was so much thrown at her. And I would love to know kind of how she did that. What was her resiliency? How was her self-care plan? Those are probably two very famous people that I would love to meet with. I think I'd really love to meet with somebody in the tech world. And I'm not exactly sure who this figure is, because it's certainly not one of the ones that you typically hear, the Zuckerbergs or the Musks.
What's a hot take that you have about anti-trafficking work that might ruffle feathers, but you're standing by it?
So Love 146 does not take a position on sex work. And that is very unique in the anti-trafficking field. There are very strong feelings about sex work and its implication on trafficking, and whether it should be fully decriminalized or whether there should be kind of what's called an equity model where the selling is decriminalized but purchasing is. I think that is a fault line within the anti-trafficking movement, and it causes a lot of splintering, and it causes a lot of people to not be willing to work with others, even on issues where there is agreement, like the fact that we need, better housing for adults. We need more safety nets. Those factions will not come together even if they agree on certain things. And so we have decided that we're not going to take a stance.
So what's the worst piece of advice that you've ever gotten about working with survivors?
The worst piece of advice that I've ever gotten about working with survivors. So, an interesting thing that I often hear from individuals with lived experience is the most important thing is for you to keep your promises. And I push back on that when I hear that, to be honest, because while I understand that they have also oftentimes experienced trauma with people not keeping their promises, I also think it's unrealistic to think that everybody is going to keep their word on everything they say. And I think that when that is the expectation, then we're not teaching healthy relationships. We're teaching a one-sided relationship that's more built on this rule than reality.
Okay, so that brings us to the end of our Insight Blitz segment. This is kind of the end of our first segment with you, Erin, about going through your career trajectory, what's brought you here. We've had little nuggets of the work that you do and your thought process in working in anti-trafficking and child exploitation. In the next few episodes, what we're going to be doing is doing a deep dive into the work that you do and what you've learned about prevention work and vulnerability at Love 146 and then previously as well. But thank you so much for joining us today.
Perfect. Thank you.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.